Hello, everybody. Welcome back to Healthcare Experience Matters. I am joined today by Coleen Santa Ana. She's a executive coach here with the HXF team, and I was hoping we could grab her for a moment and just kind of introduce her to our listeners and really concentrate a lot today's discussion on executive coaching, because I really know that's an important topic out there right now. So first and foremost, Coleen, welcome to the show. Please just introduce yourself a little bit and tell us about your professional background.
Thank you so much, Casey. I'm really thrilled to be here with you today on this podcast. So my professional background, it's in the traditional healthcare administrator career, I would call it. So I started as a hospital volunteer and went through the MHA program, did my hospital residency, and then progressed through the career ladder, associate administrator, COO, in the for-profit world. And then I shifted back actually to the non-for-profit world and moved into the corporate office where I refined some of my strategic skill set in corporate strategy, did some service line development, mergers, acquisitions, and integration work, and then returned back to operations as a hospital president and did that for about 7 years before joining this fabulous team here at Healthcare Experience as an executive coach. Coaching is really different than consulting, right? So consulting typically focuses on expert advice and solutions to solve problems and challenges, where coaching is focused on asking really great questions because the answer comes from the individual themselves or the teams. And this day and time, executive coaching is important because it's really lonely at the top. And there are so many complex problems that there are to tackle. And sometimes you just need that other person to kind of just bounce things off of, to be a thought partner, to kind of work through your thought process together, and to help you come to the right solutions. Because truly, the leaders have them inside them, but coaching is really a unique opportunity to have not just that internal thought process alone, but to have a partner.
Definitely. I really like how you worded that. We could all use help, and I am sure that it is lonely at the top, and having someone to rely on, such as yourself or some of the other great executive coaches on the Healthcare Experience Foundation team, is got to be very beneficial. And I know that you have been heavily involved with a program here at HXF that I love, and that's the DEI Foundation Certificate Program, that 2-day virtual event. And I want to know about A, like why you decided to get involved in that, and B, if you can kind of tell us why that event has been so successful over the year and what you love about it.
So I was really glad to be a part of that program because DEI is important. It needs to be an integral part of every organization, embedded in the culture. And there are many organizations that are starting the journey, but sometimes they don't have the infrastructure or the content. And it's an opportunity to work together with our organization to go through 2 days to give really a broad sense of what this content is like and the different impact it can make when you're talking about individuals, whether it be patients or teammates, as well as organizations as a whole. And so I was asked to present a portion of it and also to give a personal testimonial. And I just thought it was a great opportunity for different people to come together and share insights. And so I was just excited to be part of that project.
What is it about healthcare? When I was asking you about your background, you had mentioned I would call you a healthcare lifer. So why have you been in this sector of the economy all these years? What is it about healthcare and treating patients and being a part of that whole important process that you just are so passionate about?
Let me give you a short story about my background, then translate it to where we are today. So I'm really passionate about when you talk about transformation, and that's also individual and whole organization transformation. So I really enjoyed my time as a hospital president, specifically in turning around a hospital, because it was challenging, but really the rewarding part was not the financial turnaround, it was the culture change part. And so when you take an organization from, for example, Leapfrog D to Leapfrog A, and then figure out how to sustain that, it's really about the culture work. So when you think about healthcare, it's ever changing. It's emotionally demanding. So I just think there are so many aspects of it that you'll just never get bored. And for me personally, I realized maybe it's not the next 20 years I'll personally manage and operate a facility anymore, but I'll use the 20 plus years of experience I have and translate that to figuring out how to have organizations or people become their best and highest selves. And so that part I really feel fulfilled seeing everyone else grow.
But why could just about anyone working in healthcare and patient care benefit from having a coach?
Okay, so everybody would totally benefit from having a coach. We talked about healthcare being emotionally demanding. So just the life coach perspective is important, if that's the angle someone would like a coach, because the healthy work life balance with the intensity of the healthcare delivery right now, that's an easy example of how everyone could benefit from that. But healthcare is a team sport. So effective communication, interpersonal skills are really crucial. And I don't think anyone's ever perfect at that. Just like no one's ever perfect at leadership, right? So there are just things that all of us continue to grow in, and having a coach kind of pull from you some of your challenges and work with you to tackle through them, I think is always beneficial for everyone. And I would say everyone's looking for some type of professional growth. It can either be in advancing your career, or it could be finding more fulfillment or effectiveness in your current role. And so that coach can help you do that as well. There are many people, of course, with lots of clinicians and leaders retiring. So there are many openings now. So folks are at crossroads and they need to seek new challenges for themselves, or maybe an executive or an mid-careerist is trying to figure out, are they in the right, not necessarily position, but right lane, and I want to stay in healthcare, but maybe I need to change lanes. Then organizations, I think, need coaches no matter what level you're in, because coaches also help facilitate teamwork, interdisciplinary collaboration, because all of that ultimately fosters really great patient-centered care.
Coleen Santa Ana has been our guest today. She's an executive coach with the Healthcare Experience Foundation. Coleen, I love today's interview, but if there was anything else that I had not asked you about that you wanted to mention, briefly before I end it for us, please feel free to let us know.
Well, I want to thank everyone for listening, because it's hard to be in healthcare right now. So just thank you for your personal efforts. And if you're thinking about coaching, why not try it at least once, right? What's the harm? So hopefully talk to all of you soon.